Hello and welcome. Today we're diving into cervical dysplasia, also known as cervical intraepithelial neoplasia, or CIN. It's a condition affecting the cells of the cervix, the lower part of the uterus that connects to the vagina. Understanding what it is, how it develops, and what we can do about it is crucial for women's health. The primary cause of cervical dysplasia is infection with the human papillomavirus, or HPV. Not all HPV types cause cancer. High-risk HPV types, like 60 and 18, are most frequently associated with CIN and cervical cancer. HPV is spread through skin-to-skin contact, most commonly during sexual activity. While most HPV infections clear on their own, persistent infection with high-risk types can lead to cellular changes in the cervix. Let's talk about the mechanism. When high-risk HPV infects the cells of the cervix, its viral DNA can integrate into the host cell's DNA. This integration can disrupt the normal cell cycle and lead to uncontrolled cell growth. These altered cells display abnormal characteristics, and these changes are what we see as dysplasia. If left untreated, these dysplastic cells can potentially progress to cervical cancer over time. Cervical dysplasia is a relatively common condition, particularly in sexually active women. The peak incidence is in women in their 20s and 30s, but it can occur at any age. Regular screening programs, such as Pap smears, have helped to significantly reduce the incidence of invasive cervical cancer by detecting and treating CIN early. Often, cervical dysplasia doesn't cause any noticeable symptoms. This is why regular screening is so important. In some cases, particularly with more advanced dysplasia, women might experience abnormal vaginal bleeding, especially after intercourse. However, these symptoms are not specific to CIN and could indicate other conditions. Diagnosis typically begins with a Pap smear, where cells are collected from the cervix and examined under a microscope for abnormalities. If the Pap smear shows abnormal cells, a colposcopy is usually performed. During colposcopy, the cervix is examined with a magnifying instrument and a biopsy. The removal of a small tissue sample may be taken for further analysis. The biopsy is then examined by a pathologist to determine the grade of dysplasia. Cervical dysplasia is classified into different grades based on the severity of the cellular changes. The most common classification system is CNN. CN1 refers to mild, CN2 to moderate dysplasia, and severe to 3 to severe dysplasia or carcinoma in situ, meaning cancer cells are present but have not spread beyond the surface of the cervix. These classifications help guide treatment decisions. Treatment for cervical dysplasia depends on the grade of dysplasia and other factors, such as age and overall health. For CN1, observation and repeat testing are often recommended, as it frequently resolves on its own. For CN2 and CIN3, treatment options include cryotherapy, which freezes and destroys the abnormal cells, LEEP or loop electrosurgical excision procedure, which uses a heated wire loop to remove the affected tissue, and cone biopsy, which removes a cone-shaped piece of cervical tissue. Hysterectomy, the removal of the uterus, may be considered in certain cases, particularly if other conditions are present. The most effective way to prevent cervical dysplasia is through HPV vaccination. The HPV vaccine protects against the high-risk HPV types most commonly associated with cervical cancer. It's recommended for both girls and boys, ideally before they become sexually active. Regular cervical cancer screening, including Pap smears and HPV testing, is also crucial for early detection and prevention. The prognosis for cervical dysplasia is generally very good, especially when detected and treated early. With appropriate management, most women with CIN will not develop cervical cancer. Research continues to focus on improving HPV vaccines, developing more sensitive screening tests, and exploring new treatment options for advanced cases. Staying informed and proactive about your health is key to preventing and managing this condition.